Hi everyone, we're back now with more communication skills, verbal and non-verbal, and this is going to be part 2. And there's tons of helpful information in part 1. It would be good if you could take the time to listen to both videos because they're different stories that nurses tell, and each one is perfect for the situation in its own right. So I urge you to try both part 1 and part 2. You can never get away from communication with patients, family, visitors, co-workers, other staff members like the pharmacy, the therapist, and we can go on and on. It's just a natural part of being a nurse. Here we have a situation. We've got 3 patients who all have difficulty speaking. The one on the left has had a stroke and she's not able to communicate. The other one on the right is also a stroke patient and she's having therapy. The one at the bottom on the right, she had an injury and after surgery she had a tracheostomy and now it's being plugged, so she's just learning to speak. All 3 patients have one thing in common: they have difficulty communicating. And this is where the nurse has an important role to play, to try to be compassionate, give simple explanations, try to meet that patient halfway and not just their efforts to speak. It's going to be so much harder than the patient who can communicate verbally. And I suggest that some hospitals have like a chart where you can point at things and ask them, do you know what this is? Because some of these patients, people say they're confused and they're not. There's a difference between being confused and not being able to express oneself, which is known as expressive aphasia. Next, we're going to talk about, this is a very special situation which a nurse related. A 15-year-old patient, he was a teenager and he'd had a gunshot wound to the head and had been declared brain dead in the ICU. And just about every family member, every friend, everyone you can think of just flooded to say goodbye. Obviously they were very upset. He was only a teenager, very young. And there were so many people out there and they were not exactly happy. They were just really angry. The nurse assigned just expressed such compassion and empathy that every angry person was just calmed down. She went out, introduced herself to everyone. There were about 20 people out there. She just took them 2 to 3 at a time to the bedside, gave them time to say goodbye, to communicate their feelings, and then continued until everybody had a turn. Instead of being angry, all this anger was turned into just a wonderful situation, just because the nurse had taken the time to explain. She had expressed empathy, compassion for the situation, because losing a loved one is not easy. It never is easy, even after that person is gone. So as nurses, we need to try to work as hard as we can in our communication skills. That's my opinion. Here is another situation. The speech therapist is using really good communication skills. This patient has had a stroke. She's had what is called dysarthria, which is a weakness of the muscles, and she's just not able to speak clearly. Look at how she introduces herself. Anne, I am the speech therapist and I have doctor's orders to help you with your speech. In other words, she makes that patient feel comfortable in her care. And this is very important for us to remember. It's not my place to tell you what to do, but my suggestion is I've found as a nurse, when I go to patients and I explain what I'm going to do, introduce myself, explain, it makes them feel better than if you just walk in and do everything rhetorically without communicating what's going on. So I hope you've benefited from this. The new nurse learned something from it, and have a great day.